Did you know that the very first minute of a stroke can decide whether you ever speak, walk, or even recognize your family again? Most people don't. And that single misunderstanding is the reason thousands of seniors lose precious abilities they could have saved. If only they knew what to do before help arrived. Picture this: a 71-year-old woman from Michigan was stirring her morning oatmeal when her spoon suddenly slipped through her fingers. She tried to call out to her husband, but the sound came out broken, twisted, nothing like her own voice. In that instant, her brain was starving for blood. But before the paramedics reached her, she did something almost no one knows how to do, something that bought her brain enough time to survive. Today, we're going to talk about those exact moments, the ones that feel confusing, frightening, and unreal. And more importantly, we'll reveal the 7 life saving actions every senior in America must know because they can turn panic into control and turn minutes into second chances. And once you understand what really happens inside the first 60 seconds, you'll never look at a stroke the same way again. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. 1. Sit down immediately. Prevent the first danger, falling. When the earliest signs of a stroke appear, most people imagine that the brain is the only organ in danger. But for older adults, the very first threat is something far more physical, far more immediate, and far more preventable: a sudden, devastating fall. In those first uncertain moments, when the world tilts slightly, when a hand feels heavy, when words begin to twist, the brain is already struggling to coordinate balance, posture, and spatial awareness. What feels like a mild dizziness or a brief wave of confusion is actually the nervous system losing its footing. That is why the first and most protective action you can take is astonishingly simple: sit down immediately. Too many seniors try to stay standing because they want to be strong or because they don't want to alarm anyone around them. Some think, I'll wait a second, it will pass. But a stroke does not wait, and neither does gravity. During aging, even healthy adults lose muscle mass, reaction speed, and joint stability. A sudden neurological interruption, even for a moment, can turn the entire body into a structure without support. Knees buckle, hips rotate inward, the feet fail to respond. Falls in older adults are not minor accidents. They are catastrophic events that can result in fractured hips, spinal injuries, or bleeding in the brain long before medical help has the chance to arrive. Sitting down right away protects more than bones. It preserves precious energy the brain desperately needs. When the cardiovascular system is under stress, standing requires the heart to pump harder to keep blood flowing upward. Sitting reduces the workload instantly, allowing what blood supply remains to reach the brain with less resistance. It also lowers the risk of sudden collapse, which can occur when blood pressure drops or when the brain's electrical communication is disrupted by a forming clot. Many stroke survivors recount the moment as feeling foggy, tilted, or slowed down. These sensations are not moments to push through. They are alarms meant to be respected. By choosing to sit down calmly, deliberately, firmly, you give yourself a moment of safety and clarity. You give your brain a chance to reorganize. You avoid the cascade of injuries that can turn a medical emergency into a life-altering tragedy. And more importantly, you signal to your family, your caregivers, or anyone nearby that something is wrong. That moment of honesty, that small act of courage, is often the turning point that leads to a faster 911 call, a quicker medical response, and a far greater chance of recovery. For seniors across America, independence is cherished. You have lived decades learning how to push forward, bear pain, and steady yourself through storms. But in a stroke, strength is not standing. Strength is knowing when to stop moving. It is the choice to sit down before your body forces you to. It is the wisdom of recognizing that your life, your safety, and your future depend on one immediate action, not hesitation, not toughness, but stillness. Sitting may feel small, but in the first seconds of a stroke, it is the single most protective act you can take. It keeps you conscious, it keeps you stable, it keeps you alive long enough for the next life saving steps. And once you are safely seated, the next critical action becomes possible, a step that transforms fear into control and opens the door to real medical intervention. So, once you are down and safe, the question becomes, what must you do next in the very same minute to give your brain its best chance of survival? If you're still watching and finding these insights helpful, please comment number 1 below to let me know you're with me. Now let's move on to point number 2. 2. Call 911 and note the exact time symptoms began. Once you are safely seated, the next action you take determines the direction of your future. For many older adults, the decision to call 911 feels heavy. Some hesitate because they don't want to be a burden. Others think they can wait a few minutes to see if the moment passes. But in the reality of a stroke, minutes are not gentle things. Minutes are the difference between walking again and never walking unassisted. Minutes decide whether speech returns clearly or remains tangled. And minutes, for better or worse, determine the amount of the brain that can be saved. That is why calling 911 is not only the right choice, it is the only choice that protects your dignity, your independence, and your chance at recovery. Modern stroke treatment depends entirely on one detail: the exact moment symptoms began. This small piece of information guides the entire medical response team, from the dispatcher answering your call, to the paramedics racing toward your home, to the neurologists preparing emergency treatment in the hospital. There are powerful life saving therapies available today, but they can only be used if doctors know when the stroke started. If the window is unclear, these treatments cannot be safely administered, and opportunities are lost forever. In many ways, the timestamp becomes the map that leads doctors to the correct intervention: thrombolytic medication, clot removal procedures, or immediate imaging to track the exact location of the blockage. For seniors, being precise is an act of courage. Naming the moment it began at 4:17 p.m. or the words became slurred less than a minute ago gives the medical team a clear starting point. Even if you are alone, noting the time aloud or writing it down becomes a vital sign in itself. And this clarity gives you power. It tells the emergency team that they must move quickly, that treatment must be prepared, that your outcome depends on swift action. You are giving them the information they need to fight for your brain. Calling 911 also protects you from another danger: the false belief that symptoms will get better on their own. Many seniors experience what's known as a transient ischemic attack, or TIA, a temporary blockage that clears within minutes. But a TIA is not a relief. It is the strongest warning the body can send, a signal that a larger, more destructive stroke may be moments or days away. When symptoms disappear quickly, many people stay home, thinking they avoided something serious. But medical evidence shows that a TIA is often the prelude to a major stroke. If you call 911 even when symptoms vanish, you are not overreacting. You are taking the exact step that prevents something far worse. And while waiting for emergency responders, staying on the phone with the dispatcher offers another layer of protection. They can guide breathing, monitor alertness, and help you stay calm while your brain is under stress. For seniors living alone, that voice on the other end becomes a lifeline of stability, someone trained to listen for changes, someone who can alert paramedics instantly if your condition shifts. You are never alone when 911 is on the line. Perhaps the most emotional truth about calling 911 is this: you are not only saving yourself, you are sparing your family, your spouse, your children, and your friends from the grief of knowing something could have been prevented. You are choosing life, choosing clarity, and choosing to give your brain every chance modern medicine can offer. But after you sit down and make the call, the fight is not over. In the moments before help arrives, there is another step, one that uses your body's own structure to keep blood flowing to the brain. And it may surprise you how much difference this simple physical act can make. So, once the call is made and the time is marked, what position must your body take to give your brain its best chance to survive the next critical seconds? 3. Lie flat on your back. Keep the brain from losing more blood. When a stroke begins, the brain enters a silent emergency long before sirens are heard outside the door. Blood, which has always moved so faithfully through the body, suddenly struggles to reach the brain's delicate tissue. To an older adult, the experience might feel like a heaviness behind the eyes, a wave of confusion, or a strange disconnection from the body. But beneath those sensations is a battle: oxygen trying to push its way past a narrowing path, neurons trying to survive with what little fuel they can find. In that fragile moment, the most caring thing you can do for your brain is to give it the simplest gift, a position that makes its job easier. And that means gently lying flat on your back. Many seniors are surprised to learn that posture alone can influence how much blood reaches the brain. But it's a truth supported by decades of neurological research. The more effort the heart has to use to push blood upward against gravity, the less oxygen reaches the brain during a crisis. When sitting or standing, especially in older adults with reduced circulation or stiffened arteries, that uphill push becomes even harder. By lying flat, you remove that barrier instantly. You create a straight, unchallenged pathway from the heart to the head, allowing every remaining drop of blood to reach the tissue that needs it most. For the aging body, this position also stabilizes blood pressure, which often fluctuates wildly during a stroke. Seniors are especially vulnerable because their blood vessels may not respond as quickly to sudden changes, and a drop in pressure can mean even less blood reaching the brain. Resting flat minimizes this risk, keeping the cardiovascular system steady and reducing the chance of fainting or sudden collapse. It is a position of safety, one that protects the brain's fragile oxygen supply at a time when every second matters. Emotionally, this shift in posture can also help bring calm. When you lie down, your nervous system begins to release tension. The body recognizes the position as one of rest, not struggle. And for a person experiencing a stroke, emotional calm is not just comforting, it is protective. Anxiety increases heart rate and oxygen demand, forcing the brain to work harder while receiving less. Helps reverse that burden. It gives the brain permission to focus on survival rather than stress. For older adults, lying down may feel vulnerable. Many seniors worry that if they lie flat, they won't be able to get up again. Some fear losing control. But in a stroke, the bravest choice is often the one that requires the most trust in your own instinct for preservation. This position does not weaken you, it supports you. It keeps you conscious. It protects your airway. It safeguards the brain cells that hold your memories, your mobility, your personality, and your voice. If someone is with you, they can help guide your shoulders and assist you onto the floor, a bed, or a couch, whatever is nearest and safest. If you are alone, lower yourself slowly, using furniture for support. Once lying flat, stay still. Trust that this simple action is giving your brain the oxygen it needs to hold on until help arrives. And remember that you have already done two extraordinary things. You sat down to protect your body, and you called 911 to protect your future. Now, lying flat protects the most precious organ you have, your brain. Yet, even in this critical position, there is one more way to help circulation and buy the brain a few more life saving moments. It involves using gravity in a way most people never think about, an action so simple, yet so effective, that doctors often highlight it in emergency training. And once you are lying flat, the next step is to shift the body just slightly, but with an impact far greater than you might imagine. If you're still watching and finding these insights valuable, please comment number one below to let me know you're here. Now let's keep going with point number 4. 4. Elevate the legs 10 to 12 inches. Shift blood toward the brain. Once the body is resting flat, a stroke creates a silent competition for every drop of blood the heart can send to the brain. For seniors, the cardiovascular system often works harder than it used to. Arteries become stiffer with age, circulation slows, and the heart may need more effort to maintain steady flow. In the middle of a stroke, that weakened system is suddenly asked to do the impossible: send oxygen rich blood past a blockage that is already starving brain cells. In this vulnerable moment, you have the power to help your body by using something much stronger than muscle: gravity itself. Gently lifting the legs about 10 to 12 inches is a small movement with tremendous physiological impact. Many older adults do not realize how much blood is stored in the lower body at any moment. With age, the veins in the legs lose elasticity, and the valves that push blood upward become less efficient. This means a large portion of the body's blood volume simply sits in the legs when we lie or stand. During a stroke, that pooled blood is wasted potential, oxygen that the brain desperately needs but cannot access unless we help it move. By elevating the legs, you are not performing a dramatic maneuver. You are simply allowing gravity to take over the job the circulation system can no longer perform quickly enough. Blood flows from the calves and thighs toward the chest, giving the heart a stronger supply to push toward the brain. This natural shift increases central circulation and improves what doctors call cerebral perfusion, the amount of oxygen reaching brain tissue. For an older adult, even a small increase in perfusion can delay cell death, support consciousness, and stabilize the body until emergency treatment arrives. Emotionally, lifting the legs can feel like an act of surrender, especially for seniors who value independence. Many older Americans have lived through decades of taking care of others, working tirelessly, and standing strong through hardship. But in a stroke, lifting the legs is not a sign of weakness. It is a sign of wisdom. It shows a willingness to trust your body's natural design. It shows a desire to live, to stay present, to hold on to your memories, your relationships, and your voice. In a crisis where so much feels out of your control, this simple action gives you a role in your own survival. The movement itself does not require athletic ability. A pillow, folded blanket, or even a jacket placed under the calves is enough to create the right angle. If someone is nearby, they can help with steady hands. If you are alone, lift one leg at a time, sliding a cushion beneath them. The goal is not height, it is gentle elevation. Once positioned, keep the leg still. The blood will begin shifting on its own, and the heart will feel the difference within moments. Medically, this technique mirrors what paramedics often do during emergency evaluations. They use gravity to buy time because time is the currency of brain survival. For older adults whose circulatory systems work more slowly, this advantage is even more meaningful. A few extra seconds of improved blood flow can preserve the areas of the brain responsible for speech, balance, memories, and personality, functions that define who you are. When combined with lying flat, this one adjustment is a quiet but powerful act of self preservation. It holds the door open for paramedics and doctors to intervene while the brain fights for oxygen. You are no longer waiting helplessly. You are actively supporting your body's ability to survive. But while the body is positioned to protect the brain, there remains another vital element that stroke often steals first: the oxygen carried in each breath. And what you do with your breathing in these next moments may matter more than most people ever realize. So, as your legs remain elevated and gravity works in your favor, how can your breath become the next tool that keeps your brain alive until help arrives? 5. Begin slow, controlled breathing. Stabilize oxygen and blood pressure. As you lie flat with your legs gently elevated, the body enters a fragile equilibrium. Blood begins shifting upward, the heart steadies its rhythm, and the brain receives whatever oxygen rich flow it can. But there is another force, often invisible, often underestimated, that can either protect the brain or silently endanger it: your breath. For older adults, the simple act of breathing becomes the anchor that steadies the entire system during a stroke. And how you breathe in these moments can determine how long your brain remains alert, how stable your heart stays, and whether panic overwhelms the body or settles into calm. During a stroke, the nervous system is thrown into chaos. Messages between the brain and body become scrambled, producing sensations that range from sudden heat to trembling to a swirl of confusion that feels almost unreal. For seniors whose systems already respond more slowly to stress, this moment can trigger a deep and instinctive panic. Panic accelerates the heart, tightens the chest, and floods the bloodstream with adrenaline. That surge, while helpful in ordinary danger, becomes harmful in a stroke because it increases the brain's demand for oxygen at the very moment the brain is being deprived of it. A racing heart is like a car engine running too fast with too little fuel. It burns out quickly. This is why slow, controlled breathing is not just comforting, it is profoundly medicinal. By inhaling gently through the nose for 4 seconds, holding for 2 seconds, and exhaling slowly for 6 seconds, you activate the body's quiet defense system, the parasympathetic nervous response. This softens the heart rate, expands the blood vessels, and improves oxygen absorption in the lungs. For an older adult whose circulation may already be compromised by age, high blood pressure, diabetes, or heart disease, this controlled breathing becomes one of the few tools you can still control while the brain is in crisis. Medically, slow exhalation is especially powerful. The 6-second release signals to the brain that danger is being managed. This reduces the fight or flight hormones that tighten arteries and worsen blood pressure spikes. With each gentle breath, you allow more oxygen to flow into the bloodstream, where it becomes precious fuel for the brain cells struggling to survive the blockage. For stroke patients, this can mean the difference between losing consciousness and remaining awake long enough for paramedics to assess symptoms accurately. Emotionally, controlled breathing offers something seniors deeply crave in emergencies: a sense of grounding. While the world feels unsteady, your breath becomes the one thing you can guide. Many older Americans have spent a lifetime caring for others, raising children, supporting families, surviving hardships, and often setting aside their own needs. In this moment, breathing slowly is an act of caring for yourself. It is a decision to stay present, to stay aware, to stay alive until trained hands arrive to help you. The breathing rhythm may feel unfamiliar at first: 4 seconds in, 2 seconds to hold, 6 seconds out, but it becomes easier after the first cycles. And each breath buys more clarity, more oxygen, more stability. You do not need to force anything. You do not need to push air or strain. The goal is softness, steadiness, and surrender to a rhythm that protects the brain and calms the body. For seniors living alone, this technique becomes even more essential. The breath becomes your companion, your stabilizer, your guide. For those who are with a spouse or caregiver, speaking softly as you breathe can help them understand what is happening and help them stay calm as well. The calmness you create becomes contagious. It helps others respond thoughtfully rather than fearfully. And as your breath slows, something remarkable happens. The heart follows, the blood pressure steadies, the mind becomes clearer. The body stops fighting itself and begins cooperating with the gravity assisted position you're already in. You become an active participant in your own survival, using nothing more than the one tool you've carried since birth. But even with the brain calmer and oxygen flowing more steadily, another hidden danger remains, a danger many seniors overlook, yet one that can drastically affect circulation and breathing in the very moments you are trying to protect them. So, as your breath deepens and your body steadies, there is one more simple adjustment that can make all the difference, and it starts with what you're wearing. 6. Loosen clothing. Allow the chest and neck to expand. In the vulnerable minutes of a stroke, when every breath carries weight and every heartbeat becomes a lifeline, the body depends on the simplest forms of support to keep oxygen moving where it is needed most. While lying flat with the legs elevated and the breath steadying itself into a calm rhythm, it is easy to overlook something so ordinary, so familiar, that most people never consider its impact in an emergency: the clothes you're wearing. But for older adults, whose respiratory systems and circulation are already more fragile due to age, even a small amount of pressure around the neck, chest, or abdomen can quietly interfere with the body's ability to fight for oxygen. That is why loosening clothing is not a small detail. It is a profoundly important action. As people age, the lungs lose elasticity. The diaphragm doesn't move as freely as it once did. The chest wall stiffens. And many seniors live with chronic conditions like COPD, heart failure, or reduced lung capacity. During a stroke, when the brain may already be struggling to coordinate breathing, any restriction around the upper body becomes an invisible enemy. A tight collar, a button shirt with little give, a belt pulling at the midsection, all of these create resistance the body must battle just to take a full breath. And in a moment when the brain is starving for oxygen, anything that reduces the quality of a breath becomes dangerous. Loosening clothing allows the chest and neck to expand naturally. By unbuttoning the top button of a shirt, gently adjusting a tie or scarf, or loosening a belt, you create the space the lungs need to draw air deeply and release it slowly. This added room allows oxygen to enter more freely and carbon dioxide to exit without strain. It may seem insignificant, but physiologically, this openness reduces the work of breathing, something older adults cannot afford to waste energy on during a crisis. It also supports the slow, controlled breathing pattern you established earlier, making it easier for the body to maintain calm and stability. Emotionally, this simple act can bring comfort in a moment that feels frightening and unfamiliar. Clothing becomes symbolic. When loosened, the body feels less confined, less panicked, less trapped. Some seniors describe a sensation during medical emergencies where they feel as though they can't catch their breath or can't get enough air. Often, this panic is intensified by restrictive clothing. Loosening these layers helps reassure the mind that breathing is possible, that the body has space, and that control has not been entirely lost. This action also helps caregivers, family members, or even strangers nearby feel they are doing something meaningful. In moments of crisis, people want to help but do not always know how. When directed to gently unfasten a collar or ease the pressure around the upper body, they gain a sense of purpose that reduces panic and improves the environment for the person experiencing the stroke. That emotional calm matters because a peaceful atmosphere supports the patient's breathing pattern more than most people realize. From a medical perspective, opening the airway and reducing chest pressure is essential. Stroke symptoms often involve weakness in facial muscles or difficulty controlling the throat and airway. By loosening clothing, you minimize the chance of airway obstruction or shallow breathing, both of which can worsen neurological decline. For older adults with heart conditions, lung disease, or high blood pressure, this small adjustment becomes even more critical, as restrictive clothing can elevate anxiety and blood pressure in seconds. As your breathing steadies, as oxygen fills your lungs with greater ease, and as your chest rises without resistance, you may begin to feel the smallest sense of control returning to your body. And that moment of clarity is precious because there is still one more crucial step that can protect the brain in the minutes before help arrives. An action not about what you do, but about what you must avoid at all costs. So now that your body has room to breathe and your airway is open, what must you absolutely stop yourself from doing to prevent further harm? And why does your stillness matter more than you might imagine? 7. Keep the person completely still. No walking, no standing, no straining. In the moments after a stroke begins, the body is caught in a delicate balance. The brain is demanding oxygen it cannot fully receive. The heart is working harder than it should, and every small movement risks shifting precious blood flow away from where it is needed most. For older adults, whose muscles, joints, and circulatory systems are less resilient than they once were, the danger of moving during a stroke is far greater than many realize. This is why keeping absolutely still, no walking, no reaching, no straining, is one of the most protective decisions you can make for yourself or someone you love. When the brain is in crisis, the simplest task can become deceptive. Standing up may feel possible in the moment, but the brain's ability to coordinate balance can fail without warning. Many seniors collapse within seconds because their legs cannot receive the proper signals from the brain. A fall, especially for someone in their 60s, 70s, or 80s, is not just a fall. It can mean a hip fracture, internal bleeding, or a head injury layered on top of an already critical condition. Remaining perfectly still isn't just about comfort. It is about preventing secondary injuries that could drastically reduce the chance of recovery. Stillness also protects the heart. Every movement, even shifting from one side of the bed to the other, requires the heart to pump faster. But during a stroke, the heart is already trying to compensate for a blockage in the brain. Straining, walking, or sitting up too quickly forces the cardiovascular system to fight harder at a time when it needs to conserve its strength. For seniors living with high blood pressure, arrhythmias, or heart disease, that extra effort can push the body into dangerous territory, causing blood pressure to spike or plummet, worsening the crisis. Remaining motionless preserves the oxygen your brain needs to survive. When you move, the muscles require more oxygen, and the body automatically diverts blood to the arms and legs. But during a stroke, oxygen must stay where it matters most, the brain. Your stillness tells the body exactly that. It quietly directs circulation back toward the center, supporting the brain's survival as help makes its way toward you. Emotionally, staying still can feel unnatural. Seniors are used to pushing through, to getting up and taking care of themselves no matter what. Many fear looking helpless or worry they will inconvenience someone. But in a stroke, strength is found in restraint, not motion. It takes courage to surrender your body to stillness, to trust that doing nothing is actually doing everything right. And in that quiet moment, there is dignity, not in fighting alone, but in allowing your body the chance to hold on until trained hands arrive. Stillness also gives those around you clarity. When a loved one sees you resting calmly, they can focus their energy on guiding paramedics, answering questions, and providing comfort rather than struggling to keep you upright. Stillness becomes an act of cooperation, a silent message that says, I am holding steady until help takes over. Remaining motionless is not passive. It is powerful. It prevents injury, conserves oxygen, supports the heart, and protects the brain's fragile network of cells during its most vulnerable minutes. And when combined with the previous steps, sitting, calling 911, lying flat, elevating the legs, steady breathing, loosening clothing, it forms a shield of survival around you. But while these 7 actions create a powerful response in the first seconds of a stroke, there is still one more essential message all seniors need to hear: the truth about what ties them together, why they matter, and how they can turn crisis into control. So as we bring these steps together, what final lesson can help every older adult in America face a stroke not with fear, but with readiness, strength, and hope? A final lifeline: the power of preparation, awareness, and calm. When we bring all 7 steps together, a powerful truth emerges. Surviving a stroke is not only a matter of medical skill or hospital technology, it begins in the quiet moments before help arrives, moments where your choices, your awareness, and your calm become the strongest tools you have. Sitting down immediately protects you from the injuries that steal independence. Calling 911 gives your medical team the information they need to act fast. Lying flat and elevating your legs work with your body's natural design to keep blood flowing toward the brain. Slow breathing tells your heart to stay steady, your mind to stay clear, and your body not to panic. Loosening clothing opens the airway. And staying completely still preserves the oxygen and clarity your brain needs to survive until professionals take over. None of these steps require strength. None require special equipment. They require only awareness, presence, and the courage to act quickly. For seniors across America, these actions offer something invaluable: control in a moment that often feels out of control. They allow you to protect the parts of yourself that matter most: your memory, your ability to speak, your mobility, and the life you've built over decades. You are not powerless in those first minutes. You are not helpless. Your body is signaling, and you have the wisdom to respond with calm, steady decisions that give your brain the best chance possible. A stroke may be sudden, but readiness is a choice. And by remembering these steps, by carrying them in your mind and sharing them with your loved ones, you give yourself and your family the greatest gift: the power to fight back. And perhaps the most inspiring truth is this: these 7 actions may save a life one day, and that life could be yours. These lessons are meant to inspire you to live fully and authentically. Now, I'd love to hear from you. Take a moment to reflect and share one thing you've learned and plan to apply in your own life. Let's support each other on this journey toward embracing these truths. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this. Thank you for watching, and here's to living life on your own terms.